Hello, Dr. Murthy.
Hi. Hello, Ramya.
Enable you to share your slides. I'll just make you a host.
Yeah.
You should be able to access.
Hello, Dr. Murthy.
Hi. Hello, Ramya. Can I try sharing my screen now? Ramya, are you able to see my screen?
Yes, I am able to see your screen and the slides.
Title slide. Wonderful. Okay, thank you.
We'll be starting sharp at 6 p.m. So we'll just wait for a few more people to trickle in, and the same webinar is live streamed on YouTube, so people will be watching there as well. Good evening, everybody. It's 6 p.m., so we shall begin. Welcome to BIMAC's webinar. Bangalore International Mediation, Arbitration and Conciliation Center is a not-for-profit ADR institution based in Bangalore, and we are back with our weekend webinar series after a short hiatus. Kindly note that all our previous webinars are available on YouTube, and today's webinar will also be live-streamed and uploaded on YouTube. I'm Ramya, a young advocate, mediator, and volunteer at BIMAC, and I will be your host for this evening. This pandemic has been challenging for all of us in very different ways. It is difficult to accept the new normal of social distancing, staying at home, and several other restrictions. COVID-19 has caused immense uncertainty, grief, and stress to people. So we at BIMAC felt that this topic is quite apt for this situation, as we all need to learn how to cope with the new normal and move forward. It is my absolute honor and pleasure to introduce our eminent speaker to all of you. She is someone who is very dear to me and is someone who I admire and look up to a lot. Our speaker for this evening is Dr. Pratima Murthy. Dr. Pratima Murthy is a professor of psychiatry, and she heads the Department of Psychiatry at the National Institute of Mental Health and Neurosciences, NIMHANS, in Bangalore, India, since April 2019. She was formerly head of the Center for Addiction Medicine, NIMHANS. She is an alumnus of Bangalore Medical College and NIMHANS, where she completed her Diploma and MD in Psychological Medicine and was also the outstanding student in both courses. She has a Diploma in Psychiatry from the University of Manchester, UK, and is a Fellow of the Royal College of Physicians and Surgeons in Glasgow, UK. She is also a recipient of the Raja Ramanna Award for outstanding contribution to science and society from the Govt of Karnataka. Her areas of clinical work, research, and training have been primarily in the areas of addiction and its treatment. She has been an international trainer for the WHO, UNDCP, ILO, and many other international organizations in this area. She has several research projects as well in this area. Her other areas of research and clinical interests is human rights of persons with mental illness. She's the author of several reports on this subject and on behalf of the National Human Rights Commission. She has a deep interest in the history of psychiatry. It is truly our honor to have you here this evening. Dr. Pratima Murthy will be sharing her insights on mental health during COVID-19 with a focus on conflicts and mindfulness. Please feel free to ask questions in the Q&A box or in the chat box, and these will also be discussed after Dr. Murthy's talk. Over to you, Doctor.
Thank you very much, Ramya, for that very generous introduction, and good evening to everybody. I'm first going to share my screen and make sure that you can all see my presentation. Ramya, I think you have to enable my screen sharing, please.
Sure, Doctor. Just give me a second. I think you'll be able to share your screen now, Doctor.
Okay, great. So I just need to make sure you can see my presentation, and then I shall start.
Sure, Doctor. Yes, we can see it.
Visible now? All right. So what I'm going to take you through is really the last 6 to 8 months of when we've been in the in the midst of the COVID-19 pandemic, and really talk about both conflicts within, largely conflicts within. I'm a psychiatrist, so most of the conflicts that we deal with are within people's minds. But of course, there are ramifications in terms of what can happen outside. And let's try and look at both these together. Pandemics are not new to mankind. We all know about the Spanish flu that occurred in the early 1900s. And of course, as you know, India was not immune to it. There were a couple of crores of people who died. And one of the things is, when you actually revisit the pandemic, you realize that a lot of times history repeats itself. You can see the ladies with the masks that they had, and we are all going around in masks. We're maintaining physical distance. We have to ramp up our hospitals to take care of people who've had illnesses. There have been deaths. Fortunately, In India, we have not had as many deaths as happened with the previous pandemic. So obviously, both healthcare having improved, and perhaps the infection manifests itself differently in different parts of the world. So we've been somewhat lucky in this pandemic so far. And as you'll see, Bangalore, I think for those of you closer home, this has been doing the rounds. And, the pandemic of the 1918, almost, 10 years later, led to a lot of notifications from the government in terms of the precautions that people needed to take in terms of, protecting themselves. And perhaps, as you'll see, quinine was doing the rounds then. And all of you know that chloroquine was doing the rounds in more recent times. So in some ways, I think there's a lot of learning that can occur in terms of learning from history. Let's move on to COVID in recent times. What I have done is used a lot of illustrations from a competition that we had at our Heritage Museum at NIMHANS. As Ramya mentioned, I work at NIMHANS, and we have a Heritage Museum which highlights the history of psychiatry and neurosciences, both in Bangalore and in India. And as part of the Heritage Museum activities, we invited young children between 9 and 11, and also had older children between 12 and adolescents up to 20 to send in their pictures and paintings on what it was like to be at home during lockdown. So many of the presentations that I'm going to be using, the illustrations that I'm going to be using are these illustrations that these young minds have actually imagined in terms of COVID and what it's like to be in the presence of COVID, in the presence of the pandemic. All of us know that COVID is the infection and it's caused by the coronavirus, and it's a global problem. And perhaps, when we talk about the flat world, this is possibly an infection and a pandemic which has actually flattened the world in many ways than one. So even though there are global contexts, we have to look at what it has meant locally to us. We know the pandemic is not just in terms of the way it's had a toll on physical health, but we also recognize there are huge mental health problems, and very often people have called it a mental health pandemic as well. And the repercussions of the pandemic are not just to our health, but it's become a huge potential challenge to all kinds of well-being, including socioeconomic well-being. And that's why we need to talk not just of conflicts within ourselves, but and also talk about conflicts in the world around us. And this is a pandemic where every one of us is affected. It's not something that's outside of us. All of us as human beings have become affected, and the more vulnerable ones are possibly more affected than the others. So it's had an effect on practically everything. Ourselves, people outside us, our environments, practically every aspect of our lives have been affected. And it's just 7 to 8 months within the pandemic for us. And obviously, as we know from previous pandemics, it's not going to go away. We cannot just wish it away. It's not just like an infection which comes and just disappears. It's going to be with us for some time. So in the initial phases of the pandemic, this cartoon calls it coronization, because I think the responses to it was so universal. We knew they were very afraid of what might happen, very afraid of catching the infection. We were so worried about, being close to each other. There was so much information about, what you shouldn't do: touch your face, touch your nose, touch your mouth, avoid close contact with people, avoid handshakes with people, hand sanitization, wearing masks. There were so many discussions about what kind of masks, who should wear, PPEs in hospitals. So there was a lot of fear, chaos, misinformation, oversurge of information, all of which I think rapidly progressed from Wuhan, where it started, to Italy, to the United States, and then practically all over the world. And right from March, I think we've been reeling with various aspects of the COVID infection. In phase 1, which is the initial part of the pandemic, there was this very, fear about COVID. There were doubts about our preparedness of handling the infection, the aftermath of the infection, whether our hospitals were properly, equipped, How would we deal with the surges of patients? Every one of us was afraid of our safety, and we still continue to be. And concerns about the urgency or the lack of urgency of the response. And you would see, I mean, and these are true facts. Would you get a bed in hospital if you were sick? Was a pulse oximeter necessary? What kind of things did you have to keep in a pack in case you needed to go into hospital urgently? What were the hospitals who would accept COVID patients? So there were so many areas of things. Could you get a newspaper home? Could you buy stuff? Could you go to the supermarket? Was it safe to kind of get the things into the house? There was thousands of questions that we kept on asking ourselves. And the biggest source of tension, if you will, were actually the media, the social media, television, etc., because there was so much misinformation, right from what sanitizers should contain, what sanitizers to use was, whether you had to, there were, a newspaper vendor who came home once told me that, entire people, sets of apartments refused to buy the newspaper, and because they were worried that the things would transmit through the newspaper. So similarly, there was a lot of information overload, especially about what medications to take. And just yesterday we were discussing that some people, even though the doctors did not find any evidence for certain kinds of very expensive medication, there were patients who were demanding that the most expensive medication, which has unfortunately potential side effects, be given to them. So a lot of information as well as misinformation. And as doctors, I must tell you, one of our biggest sources of strain and tension were the rapidly changing guidelines. Practically every day they would be changing guidelines, how we had to manage our patients, what kind of zoning we had to do for our patients, what kind of testing was most appropriate. Fortunately, that has stabilized somewhat. So in some ways, there was so much of tension in the first few months. We call it a readiness burnout, that people got so exhausted that possibly in the months when the COVID actually became widespread, at least in Bangalore and of course in other places, we were almost burnt out with all this information. And that's worrying, because I mean, we just reached the kind of the peak of the pandemic, if you will, just about a few weeks ago, a couple of months ago, and we're still not out of it. So it's very important to be careful and not get complacent or even burnt out as far as the ways of dealing with COVID is concerned. This illustration is by a 10-year-old young lady called Trisha, suggesting how COVID has kind of enveloped the world. In the phase two, which is in the thick of it, we know that there are those of us who were in lockdown. Young people still continue to be in lockdown. Our schools and colleges have still not opened up. Of course, there are people with various kinds of responsibilities. Those who are working from home have had, of course, a lot of responsibilities of working at home as well as working from home. And that in some ways was initially quite a novel thing. And I think people quite learned how to adapt to it. But now you're realizing that it's quite difficult. For example, I've just come back from work, and I continue to work from home because so many webinars, so many discussions, so many teaching programs have kind of shifted to beyond working hours. And that also can cause stress and strain to a lot of people. And of course, if you're a frontline worker, it's been almost endless the last 6 to 8 months. There's a lot of work, there's a lot of stress at work, there's a lot of lack of clarity at work, and of course the proneness to infection, whether you're a doctor, whether you're working with the police force, whether you're working in a civic responsibility. I think it's very important to understand that when you're in the thick of it, there can be a huge amount of strain. And that's why we know, for example, among frontline workers, the increase in emotional problems is possibly much more than among the general population. We've recently completed a study of the police as well. And, again, emotional problems amongst the police is also much higher than perhaps in the general population. And the general population itself, as compared to 1 in 10 people having had psychological difficulties, it's possibly gone up at least by 2 or 3 times. And there have been lots of studies which have looked at common mental disorders like depression, anxiety, and so on, which has increased even in the general population. So what is the normal range of reaction? We must understand that in this pandemic, we have normal people exposed to extraordinary situations. And that's when, it can become quite stress inducing. So either, there's been, sometimes it's been very good because you tend to feel you're at home, you're more available to kids, you're doing things at home. So those are the positive aspects of what we've seen during the COVID lockdown. But for everybody, the even though it's not social distancing but physical distancing, and you can actually stay socially connected, for a lot of people it's been isolation, loneliness, excessive use and reliance on internet, social media, and so on, which has come with its own set of problems. So from younger people to especially to older people, especially for older people who are already feeling lonely and bereft of connectedness, the pandemic has been quite you know severe in the way it's exacerbated the loneliness and perhaps depression among the elderly, except for a few elderly who've been able to stay connected. For many of them, right from going out to buy provisions to looking after their other needs, especially the health needs. And we know that hospitals, for example, apart from COVID care, a lot of people are hesitant to go into hospitals, so attending to their non-COVID health problems, especially what we call non-communicable diseases like hypertension, heart disease, diabetes, cancer. Many of the people who've had these problems have also found it very difficult to access care. So even for normal people, it's been difficult. So you can only imagine if a person had a pre-existing problem, let's say a pre-existing mental disorder, or a difficulty in handling stress, this can become a more challenging situation to manage. We describe what are called the worried well, and many of us possibly fit into that category. And here's the example of a 40-year-old nurse who was afraid that she would get infected. She was provided adequate personal protection like masks, gloves, visors, and so on. She thought it was enough, but then in spite of that, she would get uneasy and panicky. And when she was at home, her sleep became disturbed. She became very irritable, even for small reasons. And she would worry about whether the patient that she was seeing would be from a containment zone, have fever, etc. And she would constantly check with her colleagues and peers whether she was at risk, and would constantly seek reassurance. She was able to work, but her work performance reduced, and her colleagues felt that her anxiety was out of proportion to the situation. And there are lots of people like this who can be described as the worried well, and they go through a lot of emotional distress, with these anxieties. Of course, this can become abnormal when it causes a lot of dysfunction in a person's personal life, their social lives, and their occupational functioning. It can also, when it becomes very severe, lead to absenteeism from the workplace, reduced performance and productivity. There can be rapid changes in mood with anger, irritation, crying spells, and so on. Substance use, and I'll talk about that a little later. There can be an increase in the use of alcohol and other intoxicants to deal with the emotional problems. People complain of poor memory, and of course impaired physical capacity and their working ability. So whether you're working on site or at home, if this stress becomes overwhelming, it can affect their functioning as well as their productivity. How can these present? When there is intense psychological distress, there can just be symptoms, or they can be what we call a syndrome of anxiety, with both physiological symptoms in the form of the heart beating fast, the mouth becoming dry, tremors of the hand, a feeling of dread of something, a feeling that something can happen, and panic attacks, sudden episodes of anxiety where people often mistake that they might actually be having a heart problem. That can also occur. Sleep disturbances are extremely common, and especially when you're at home, when your routines are kind of disturbed, there can be disturbance in the sleep wake cycle. Substance use is something I've mentioned, and people who have pre-existing mental health disorders can actually get worse. So loneliness, and inability to kind of go out and participate in things can be quite a problem in terms of causing emotional problems as well. So the distress and anxiety related to COVID can span from excessive worry about contracting the infection, worry about the complications of the infection, guilt about if you have COVID that you might pass it on to somebody else, feelings of sadness, crying spells, feeling incompetent at work, and that's a vicious cycle of doing badly, feeling awful, and again doing badly, irritation, a feeling of trepidation that something awful might happen, reduced appetite in addition to the reduced sleep. And when these symptoms become severe and a person feels very helpless and hopeless, the person can also feel that life is not worth living and can feel suicidal. So these stressful times are particularly important times where one must understand that psychological distress, the symptoms of anxiety can actually aggravate to much more severe symptoms of agitation and can transform into more disturbing things like these kind of thoughts. How does one deal with the so-called worried well and with these psychological fears, anxiety, if it's not too much? The most important way is to understand that a certain amount of feeling upset, sad, or anxious is very common during a crisis. And the best way to deal with it is to share it with somebody, especially with family or close friends, and try and overcome that. The second thing is to be well informed and not to constantly watch the social media or the WhatsApp university, as people call it, because it's a source of a lot of misinformation, but just to follow bulletins which are scientifically which provide good and scientific information, because otherwise this can be overwhelming and misinformation can lead to a lot of fear, especially things that are happening. I mean, I think one of the greatest times when we had a lot of fear was when we watched on TV what was happening in Italy, what was happening in some of the European countries, and it was extremely disturbing. So I think it's important to really know what's happening in and around you in a proper manner so that the fear can be handled quite easily. The second thing is to really realize what can be controlled, and to do that, especially your own body and mind, how do you control it? The simple strategies would be to eat healthy, to sleep properly, to get adequate physical exercise, to avoid the use of intoxicants, to make sure that there are ways that you calm your mind, to have a good schedule of what you would do during the day so that everything is not awry, and of course to maintain self-care, personal hygiene, and of course the hygiene that has been quite well elucidated and shared as far as COVID-19 precautions are concerned. The other thing is, of course, to attend to the immediate environment, to organize it better. If you're working from home, to have proper spaces so that you differentiate your working space from your non-working space, and make responsible choices of going out of the home only when you need to. Especially now, you see traffic has come back to practically its previous self. I don't think anybody's taking going out or limiting going out seriously enough. And I think that's something that we all need to do and tell others to do as well. In terms of our eating and drinking, I think it's very important, especially if one does not have the usual amount of exercise, to be careful what we eat, but not just eating. It's also the news that we consume, that we only go to reliable sources, that we have adequate entertainment. And it's amazing what Amazon Prime and Netflix and all that have done in terms of giving us a reasonable amount of entertainment to take our minds away, and also help us to deal with our boredom. It's also important, especially in the early parts of the pandemic, we needed to make sure that we were adequately stocked with things at home so that we didn't have to go out, that we didn't run out of essential supplies. We need to make sure that our medications are adequately there. Self-protection is also very important. And I think everybody now has a reasonable understanding of what do you need to do to look after yourself. But equally enough, we also need to be concerned about protecting others, cough etiquette, sneezing etiquettes, disinfecting of our hands. I think this is something that we all know and reasonably follow so many months into the pandemic. So sleeping well, eating well, relaxing, Spirituality and is something again that a lot of people have turned to. So you'll see people attending Bhagavad Gita classes, or doing some other form of spiritual exercise. People have also learned to have newer hobbies. I know people have started listening to music, enrolling for online music classes, learning new musical instruments, connecting with people whom they had lost contact with. And that's where social media has helped hugely. You're now in contact with schoolmates that you had lost contact with for the last 30 years. So I think it's how you look at it. It's been a time of rediscovery. It's also been a time of stress, and I think various people have dealt with it in different ways. What can happen if there is a lot of stress is that it can lead to emotional exhaustion and what we call burnout. This is especially common for people who've been through a lot of stress in the initial times, that they can become extremely numbed, lacking compassion, lacking empathy, having a reduced sense of accomplishment, and therefore not being able to function. And any kind of chronic stress, unfortunately, leads to this kind of burnout, and we all need to be aware of that. I mentioned conflicts without. And I think one of the things that the pandemic has also brought about is not just the problems within ourselves, it's the fact that it has given rise to increasing violence, including interpersonal violence. We all know about economic stress, and we really haven't realized uh, the the height and the ramifications of the economic stress that might occur in the years to come. We've all read about the migrant crisis and what it has meant to people where there has been a reverse migration. Interpersonal stress. I think both when you're closeted at home, there can be interpersonal stress between family members. When you have to work in a stressful environment, that can also magnify stresses and increase stresses. We are becoming aware of job losses, economic and financial stress for people, and particularly for vulnerable groups, whether it's children, whether it's people living in homes, whether it's people living in correctional institutions, whether it's the elderly. We know that vulnerable groups can actually be much more prone to the effect of conflicts. And of course, job losses, again, are something that we have to very, very carefully look at, because I think in the days to come, we're going to see a lot of that job losses. This is a very interesting 7 points that a group called the Crisis Group 2020 has actually come up in terms of the larger conflicts that might occur as a consequence of COVID. I did mention the vulnerability of conflict, of certain populations, which are normally there in in our demography. But there are also a group of conflict affected populations. And for them who are already in the throes of a lot of problems, the COVID pandemic can really aggravate many of the problems that this particular population faces. We also know that there can be damage to international crisis management. I mean, there were so many crises looming all over the world, and the conflict resolution mechanisms can also be affected. And we know that countries tend to turn inward and be much less focused on the larger problems of the world. Risks to social order, and that is something that can lead to a lot of unrest, that can lead to a lot of demonstrations and conflicts, and people coming out to the streets, because when there is socioeconomic downturns, this can also lead to a lot of problems. Healthcare also, and access to healthcare also can lead to social disorder. Of course, we all know that in any time there is a crisis, people take advantage, and there can be political exploitation of crises. It is anticipated that there may be major changes in power relations. And I think for all of you from the legal background, these are important issues to kind of try and understand. There can be polarization in relationships between countries, movement of people between countries, the tensions in terms of the quarantining, rules in different countries, the way people are turning back people from countries, maybe because of healthcare, because of infection, and so on. And of course, potential crisis mitigation measures, which can also be a source of conflict. So there are several sources of conflicts that one must be aware of. How do you overcome distress at an individual level? The first and the most important thing I think that we need to pay attention to is self-care. And I think that's the most important thing. All of us need to be responsible enough to make sure that our self-care is not compromised. We need to ensure adequate breaks and adequate sleep. Physical distancing is not social distancing, so we must make sure we are better connected with our relatives and friends. We need to carry out activities and develop new hobbies because that's very important. I mentioned regular exercise, a healthy diet. Spiritual and religious activities also become very important, even for people who are not otherwise spiritual. I think this is an opportunity for people to see if they can derive some solace from these activities. Making time for yourself and your family is very important. And that means quality time. Just because you're working from home, it does not mean that you have quality time for your family and others. And the most important thing is to recognize when you have severe emotional distress and seek out professional help, and if necessary, medication as appropriate, whether it's for COVID, whether it's for mental health problems. We also know that COVID itself can produce a variety of psychological and neuropsychiatric problems, include what we call the long COVID, extreme degree of fatigue, tiredness, woolliness in the head, memory problems. So anybody who has had COVID must be aware that COVID itself can cause problems in addition to all the other things around COVID which can cause psychological problems. I think one of the most important simple ways of dealing with problems is learning how to solve a problem. People say that the simplest way of solving the problem is understanding what is the problem, why is it occurring, who can be the solution to the problem, what are the possible solutions to the problem, what is the solution that is best to try in the beginning, what are the various options, how do I try one solution, if it doesn't work, what can I move on to? And then also turn to other people for support and try and solve the problem, and not to be overwhelmed with too many problems, but prioritize the problems, see what you can have solutions for, and try and address them so that you can reasonably feel confident of having solved the problem. Enhancing social support is also very important. You need to be smart in getting people to support you. It might be family, friends, people in the community, medical support as well, organizational support as well. So it's important to know how you can enhance the social support, because no man is an island, and it's only when we feel so supported that we don't feel overwhelmed and can get over any kind of crisis. As far as the worried well, I spoke about the 40-year-old nurse. It's important to be empathetic to that nurse, make her feel understood, explain that the fears are understandable, provide proper information, try and point out the discrepancy between the symptoms that the person is experiencing and proper symptoms of COVID. Now we know the actual symptoms of COVID, and without providing unnecessary, simply reassuring, try and address the problem that the person is facing, teach them ways of relaxing so that they don't feel overwhelmed. Substance use is another problem that can occur during COVID. It might occur as a consequence of stress. It might occur because it was already there in the past. People might self-prescribe medications to increase sleep and to reduce their anxiety. And they might experiment with additional substances and also undergo substance withdrawal when they're using substances. One of the ways to mitigate that is to make sure that they deal with stress, that they get proper advice to cut down, that they explore what are the trigger situations and try and address these. Of course, if substance use disorders become severe, people must reach out, like they must if they develop severe depression or anxiety. For substance use, for tobacco use, there is what is called a national tobacco quit line. There are what are called M cessation services where you can get SMSs to quit. People may need short-term medication, counseling, and professional help if they are using substances in what we call a dependent pattern. As far as sleep is concerned, sleep disturbances can be in the form of initiating sleep, getting up multiple times at night, early morning waking, and for some people, it can be excessive sleep, and that's also a problem. So one must be aware that one must at least try and maintain one's sleep hygiene. And how do you do that? You do that by going to bed at the same time each night, by reducing exposure to TV and mobiles for a few hours before you go to bed, not keeping your telephone next to you, using the bed only for sleeping, making sure that the ambient light is not too much, avoiding excessive fluids before bedtime, especially caffeinated drinks, of course, avoiding tobacco, alcohol, and drugs, and wearing comfortable clothing before going to sleep. Another important thing that people are recognizing, especially post-COVID, is what is called post-traumatic stress disorder, particularly among people who've had COVID, been admitted to hospital, seen the death of a loved one, and so on. And this can be characterized by feeling extremely aroused and anxious, having repeated flashbacks of a traumatic event, feeling extremely emotionally distressed, and avoiding anything to do with that particular trauma. It's important to recognize because a lot of people don't understand it and don't get professional help to overcome this particular problem. At the level of organizations, I think it's very important to spread awareness about mental health, about stress, and how to manage it. Having team meetings to really decide how we can all work together and reduce the stress, and also be a little flexible so that we can help each other. Some organizations, in addition to work from home, have additional help that they provide, maybe women, maybe people who have elder folk at home, so that some degree of support is provided. And of course, self-care is very, very important, and having proper protocols. So in our hospital, for example, we are providing help to our own staff who turn COVID positive or required to be quarantined and so on, so that the burden is reduced. Also, in terms of educating them in what kind of a kit to keep ready in case they do develop COVID symptoms, where to go, and so on. This kind of help can be extremely important to make sure that people get over this without too much stress. Good communication is extremely important. Proper guidelines for testing, quarantine, and treatment is important. Having regular team meetings to really find out what are the best solutions, to debrief, etc. And in organizations, a grievance policy, especially in the times of COVID, can be very important to address people's issues. Mutual support is very important, and especially during stressful times like hospitalization and death, having people to support you, having flexible schedules, having a buddy at work to watch your back, and making sure that particularly people who have disabilities, who have had previous mental health problems are also helped is very important. And maybe having a tie-up with the mental health service can also help to make sure that these problems don't, kind of escalate to a serious emergency. What happens when we come out of Corona? Before I go to that, I mentioned anxiety. I must also mention the signs of depression. Depression, all of us feel low at, even at other times. But if you feel persistently low, not interested in doing the things that you were interested in earlier, not sleeping well, losing appetite, losing weight, having negative thoughts about yourself, about the future, feeling helpless and hopeless and having crying spells, or feeling that it's better not to live, or feeling that it's better to die. These are all classical symptoms of depression. It's very important not to hide this depression, but actually communicate it to people, to somebody around you, so that somebody can help. It's always very important not to feel stigmatized about mental health conditions, but to reach out. How do we come out of Corona? I think the community spirit is the most important, and we've all seen examples of this. We also need to understand that there are positive sides to it. So we may be locked up, but nature is rejuvenating. Carbon emissions have come down. We're actually able to travel virtually now. So if you learn how to deal with it, it's not so bad. We need to sleep better. We need to change our work habits. We need to be in touch with family and friends. We need to have breaks in our routine. restructure ourselves. And people are talking about a new normal in the days to come, in terms of our work, in terms of our environment. And of course, all of us are improving our access of digital technology, which I think has been quite a game changer in coming out of Corona. But at the same time, I think the COVID situation has given a stark reminder of the inequalities that we face, the vulnerability in our health, social, protectional systems, as well as our public services, the economic consequences, which we really have not grasped in its entirety. There are going to be mergers, acquisitions, companies closing down, people losing jobs. The digital technology is at a boom. But whether it's going to result in growing divides is something that we need to see. Beyond Corona, people are talking about what's going to happen to our psychology beyond Corona. Are we going to become better human beings? Are we going to be more conforming and morally more, vigilant? Are we going to become, wary of people, less trusting of people? Is there going to be instinctively greater social distancing? Or are we going to come out more resilient and compassionate and work together as one global world is something that we need to look at. And remember, it's not just about not being mentally ill, but also making sure we are well physically, emotionally, spiritually, financially, occupationally, socially, and also environmentally, so that we shift from a paradigm of illness to well-being even during COVID times. What's waiting for us? This is a great time where humanity is tested as never before. Everybody needs information and positive support. And of course, we need stories of humanity rising to the occasion. Since we are in it all together, we need to come out of it all together again. And I'd like to end with acknowledgments to my colleagues in the NIMHANS Heritage Museum, the curator Amrita, and all the young artists through whose eyes the different aspects of the pandemic could be visualized, and many of whose illustrations I've actually used in my presentation. Thank you very much for your patient hearing. And of course, I'd be happy to take questions. Thank you very much.
Thank you so much, Dr. Murthy, for this enriching session and for explaining the stress caused due to COVID-19, burnout, as well as the worried well, as well as ways of identifying and dealing with the problems. COVID-19 causes a lot of people to have dampened spirits. Thank you for also sharing the signs of depression, which is so difficult to identify. And as you rightly said, staying optimistic is the key. I also personally loved seeing the creative artwork by the young artists who submitted their work to the Heritage Museum. Thank you so much for displaying them on the slides. We are now open for questions, so feel free to, I'd invite the attendees to feel free to start posting your questions either in the chat box or in the question and answer box. And we have a few questions that we received elsewhere as well, and I'll start by reading those out. So firstly, this is regarding work from home, doctor. For lawyers, mediators, as well as other professionals, work is generally stressful, and work from home is even more stressful as professionals are busy with both housework as well as office work, and they find it very hard to draw boundaries. So, how can one be consistent in drawing boundaries to ensure that work doesn't overtake your social life? Because it might be possible to do maybe one off or once in a while, but it's hard to be consistent. How do you suggest being consistent in taking care of yourself?
Yeah, thanks for that. We've always been talking about work-life balance. When we were working on site, even if you did, bring home some work, there was a definite, separation of space, which allowed you to leave, the work, the issues at work, and come back. Now, what's happened, I think, is almost like a seamless flow between work and what you're doing at home. webinar fatigue is again something that all of us are going through. So actually, I hesitate every time to get involved in a webinar, because even for me, it just means that, that's much less time spent. And, folks at home will say, oh my God, why do you have to do it outside working hours? But I know a lot of people who are taking classes outside working and so on. So I think we need to. There was a time when there was a honeymoon period of work from home, definitely, in the first couple of months, when it was very exciting. You could get up a little later, you don't have to formally dress up, you could be switching it on and doing something else. But I think people are realizing it's so much more now. I had a person, a teacher, who was saying that in her class there are actually students who've just put on their they've come online, but they're doing something else. This teacher, periodically every 15 or 20 minutes, is actually asking an online question and making sure that the students are actually answering it. So I mean, it goes there as well. But coming back to what can you do, I think right now, after experiencing this for so many months, I think we need to make conscious decisions about, what is the time that we will spend at work, whether it's in a continuous basis or whether it's chunked, but giving us enough time to do other things. I think that's extremely important. So I think it's also important to make proper timetables as to when I will do work and when I will, stay away from work. It's to have enough things. I mean, I think unfortunately, the problem is that screen time has increased hugely. And we all know that screen time can cause visual fatigue, it can cause headaches, it can cause a whole lot of orthopedic problems if we are continuously sitting at the computer, hunched up, etc. So, the ergonomics, all of which were talked about, I think need to come back. So, right from the posture, the time you spend on your computer, the number of hours you spend or need to spend on work-related problems. And I think if you're working as a team, I think the team must sit together and actually decide what is reasonable work from home and what are boundaries as far as work from home are concerned. I'm sure there will be the odd. And remember also, there is tremendous stress on people, perhaps, because a lot of companies are now saying, perhaps, we'll shift to a work from home model because it's maybe less expensive for companies. But the cost that it will kind of bring on to the employees in terms of this kind of stress is something that everybody must fathom. They must factor in before they kind of make these decisions. So I think all of us must collectively get engaged in this and really make those compartments. As somebody, we were reading this morning that when you move from one room to another room, that's when you can leave your thoughts behind and actually move to another space. If you don't have that and you're stuck in a room all day, the same kind of things get ruminate in your head and can cause a lot of distress.
Thank you, Doctor. That's so true. And I do agree about webinar fatigue. And that's why I'd like to thank you once again for sparing your time today. We have a question from a fellow mediator from Venezuela, Mr. Israel. He asks, how can I tell my family at home to avoid disturbing me while I'm working in an educated form? I feel that I'm ignoring them, but I also need to focus on what I'm doing. I feel like most people do face this same or a similar problem, especially when they do something that their family doesn't really understand, or if it's a line of work that their family might not comprehend properly. And I think it's quite an important question.
Absolutely. I mean, I really feel for Israel, because I think all of us go through this problem. And it's even worse, even more problematic when there are not enough spaces at home. I can tell you that when I'm speaking to you now, that I don't know if you can hear the TV behind, TV downstairs. Probably you can hear it, but everybody needs their space. And I mean, just because I'm doing a webinar, I cannot expect everybody to be silent and allow me to get on with what I have. So I think the first and most fundamental thing is actually, if people respect the work that you're doing, and in some ways, understand that you need this space. So I think in some ways, sitting them down and saying, look, these are my hours of work, and I would like to do that. It can be very difficult if there are young kids at home who don't understand, or certain chores that are expected that you will contribute to, and you're not able to do it. So I think a lot of it, like we said, teamwork to discuss. I think the team at home must all sit together and also have some kind of an understanding as to what is me time, what is work time, and what reasonably can be done to support you in that work time. And at the same time, I think the compromises in terms of what is it that you need to finish and contribute to at home while you're doing that. It takes a lot of understanding between people to really appreciate the concept of what it means to work from home. And that can be pretty, I mean, just because the people see you looking, sitting in front of a computer and staring into it, I mean, there must be some families wonder, is this what this person does at work all day? I mean, and therefore, to really, it can become a challenge to really explain the intricacies of what you're doing, And I don't think there is a simple solution there, but I think a lot of negotiation, and I think lawyers can teach that best. People who are in arbitration, etc., can teach that, because these are the skills that families need to now understand. Yeah.
Yes, doctor, that's very true. There's another question that we received, which pertains to the digital divide. A lot of professionals who aren't familiar with the use of technology, as well as, I don't want to generalize, but some senior lawyers and professionals have also spoken to me about how they find, well, it's quite sad to hear that they find themselves redundant, and I have to tell them that they're not. But they find it quite hard to cope and adapt to this new normal because they feel like they're not working to their truest potential. A lot of people about the age of 65 cannot go to courts. I'm talking about lawyers here, and I guess in most professions, they're not allowed to go. It's better if they don't go out, so they stay at home, they're confined to their houses. So it's just quite sad I feel bad for them, but I don't really know how to help them. And what advice do you have for them?
While age is a number, it's become very, very relevant in COVID times. And, I can also tell you that, we've been personally affected by it too. So, for example, in my own unit where I work, my colleagues told all of us that those of us above 55 should not be going into to work. And very sweetly, they are actually covering for us. My husband, who is a pulmonologist, who is a COVID warrior in the true sense of it, because, this is a pulmonary disease. He has not been allowed to go into the COVID wards because of age and other restrictions. And it's been actually devastating because, that's the time you'd like to be there to help people, to kind of contribute, and you're not. So each of us has to rediscover ourselves and our roles. So what he did was, he is now completely and engrossed and even busier than before in actually developing protocols for the hospitals, providing online consultations for patients. So I think it's the whole thing of rediscovering oneself, very importantly. The second thing is to actually learn a new skill, which is learning how to use digital technology. And I think that's where the younger people can be proactive in actually providing this training, getting people to come out of their shells and actually use these kind of modalities. So I know more and more that the senior people are trying to use digital technology, and I think the experience that they have is no way going to be compensated by any of this modern technology. So many of them need to be using that experience, providing telephone consultations, for example, providing various other kinds of consultancies, for example. And I think it's for the younger professionals to reach out to in some ways engage the older professionals to offer this kind of help. So perhaps they also feel a little reticent to ask for help because it's a sign of weakness or a sign of thing. But I believe that you're a student all your life. So I think the attitude that it's okay to ask a younger person, how the hell do I get this technology working, or what computer should I buy? And I do it all the time with my younger colleagues because I haven't the faintest idea what's new on the shelf. So when it comes to asking about the latest computer, the latest technology, I always turn to my younger colleagues. So having this relationship open and willing to learn as well as to exchange experience for technology, I think that's the kind of best mix that you can possibly get. And of course, if people are feeling isolated and lonely, it's important for colleagues to kind of draw them out and involve them.
Thank you, Doctor. I completely agree with you. And I think this pandemic has also proved that we never stop learning, because this has been an entire learning experience for all of us. We have two questions. I'm going to combine them. One is with respect to meeting clients and colleagues. It's about how we can avoid meeting clients without hurting their feelings about meeting them, because now I think post lockdown, a lot of people are more inclined to go out, and they take it personally if you tell them that you don't want to meet them because of COVID. Some of them even feel offended, and it's a bit hard to deal with that. And I think we have a question from a young attendee who asks, how do you resist yourself from going out when you see so many people on social media going out and meeting their friends? And this is quite true, because a lot of people are still out partying and having fun, where you're locked in your room, but you know it's good for you. But at the same time, you feel like you're missing out. It's this term called FOMO, fear of missing out. So what are your thoughts on this, Doctor?
Yeah, I think all of us suffer from FOMO, no doubt about that. So, I mean, I think, look, there are times in life where one absolutely must follow rules. And that happened during lockdown. Whether you liked it or not, there was the government enforcing restrictions. And I think compliance with those restrictions were very important. And that's actually easier if somebody else puts these restrictions on you. It is much easier than when you have to develop these restrictions by yourself. So that's where rules help. But subsequently, I think there are those of us who are extremely, you said FOMO, but there are people who are extremely phobic. They're very phobic about illness. They're totally neurotic as far as their sanitization and stuff like that goes, the masks that they wear, etc., etc. There are going to be those completely averse to any risk. That's a problem. Complete complacency and believe, oh gosh, I can party till the cows come home and nothing's going to happen to me, is also a problem. So I think finding some kind of middle ground which makes me sensible, take precautions. If for example, I have to go and greet somebody who's very, very near and dear to me, I make sure that I, use, physical distancing. If I have the remotest thing that I have a cold or a cough or a fever or I'm not well, I make sure that I avoid people. Whatever is absolutely essential. I mean, there are now rules about, where, for example, if it's a marriage ceremony which cannot be put off, etc., that where you need to go. I mean, I think it's about making sure that you're reasonably, sure about avoiding too many risky situations. I think that's what you need to learn, because I'm sure gradually, at least in 2021, hopefully 2020 will go away in about 6 or 8 weeks' time. In 2021, we are going to go back gradually to what we were doing. But I think it's important to continuously calibrate our sensibilities, to make sure that if it's something that can be put off for a slightly longer period of time, it is. I mean, we all know people have had COVID parties and actually gotten COVID and spent millions of thousands of dollars on actually coming out of their illness. I mean, that's a damn stupid thing to do, isn't it? And at the same time, therefore, I mean, one has to be sensible about it. I mean, there's no other way one can actually deal with it. Life, whatever you can put off. I mean, procrastination is a bad thing generally, but here during COVID times, whatever can be put off for a slightly later period, I think is worth putting off. Okay, it doesn't mean that you have to give up everything, that you can't go out to a restaurant, once in a way, or get in food from a restaurant. I mean, the next best thing to going to a restaurant might be actually getting in food to a restaurant. You spoke about how do I deal with clients who can mistake me. I think one of the ways is to keep good communication going, is to be clear as to why you are saying what you are saying up front, before there can be any, chances of, misunderstanding. I think a misunderstanding occurs because of improper communication. So keeping the communication clear, simple, telling the person why you are concerned about not doing this, perhaps taking a rain check for a later time when things settle down. These can be ways. And if the person is going to take offense at every small thing, then perhaps you need to really reassess whether you want that client, unless that client is so important for you. I mean, a person who constantly mistakes everything that you do cannot trust you. And I think trust is something that needs to be built up between client and lawyer. So I guess that's one of the important things to think about.
That's very true, Doctor. Thank you. There are two other questions that we have that I'm going to combine again. One is regarding small issues within families that snowball into larger issues and deeper conflicts because of the fact that everyone is staying at home. I think the attendee asked how we can resolve this. And another question is with respect to young couples or just couples in general, because seeing each other's face constantly without a break from work results in numerous conflicts. And as a lawyer during this time, and also as a mediator, I think maybe some of the other lawyers and mediators might agree with me, we've seen quite a large number of divorce cases, and it's quite sad, honestly. So the attendees would like to know how we can work towards resolving these tiny miscommunications or conflicts to ensure that they don't snowball into, let's say, a court case. Because it's not only for divorce cases, it could also be a family run company where you have, brother and sister shareholders taking each other to court through bitter rivals. So what are your thoughts on this, Doctor?
I'm not sure this did not happen before COVID. I think it did. I think it just gets more amplified and more in your face during these times. Again, there are no simple solutions for this. I think a lot of what you said, the two words that you used, conflict resolution and communication. And I think, and compassion. I mean, so these are the three C's that I would see as being very, very important, in relationships. And I think it's important to not allow that snowballing to occur, to identify sources of tension between people as early as possible, to make some compromises so that, this is what is called meeting each other more than halfway. So, making compromises and making sure that, you give in at times, you make those changes and adaptations so that the other person thinks. And I think couples have to learn how this does. This happens in sparring. The same kind of thing needs to happen with couples. When you feel that somebody is kind of, a bit overwhelming, the other person learns to retract. You also learn to sit down and talk about these things. When we talk about spaces, we talk about physical spaces, it's also about personal spaces and giving each other the space to do your own thing. And that your own thing might just be reading a book or listening to your own kind of music or TV time. One of the big conflicts in families, when they're all at home is TV time. So I think, really figuring those things out can be as important as resolving conflicts in big companies, because I think the principles of those are the same. So I think all the C's that I mentioned, recognizing that there are sources of tension, willing to compromise are very important. And the same kind of approaches to good communication, which is really being open, not saying, you never do this, you're always doing this, having good eye-to-eye communication, watching our non-verbal communication with each other, saying, not just being brusque with each other, not showing irritation to each other. These can also be very important. And of course, I think valuing each other is also very important. Okay, I think there will always be, as I mentioned, normal people in extraordinary circumstances is what we're seeing now. And I think there can definitely be irritation thing. So I think forgiving and forgetting are also extremely important qualities that we need to develop. to be able to deal with these situations.
Thank you, Doctor. Our final question for this evening is from a lawyer in Delhi who asks, how do we manage our livelihood as an advocate, protect our life and life of our family members, as well as grow in the profession? I think this would also apply to non-advocates and non-lawyers, people in other professions as well, because a lot of people are facing I guess, work issues. Some of them are undergoing unemployment. There's also stress related to finding a job. But it's quite hard to manage all these things, especially because work stress or unemployment stress can be quite overwhelming.
So, I mean, this is going to be, there's no doubt that it's going to be very, very difficult for all of us, irrespective of our current financial status or what it was earlier. So I think we just have to accept that the next few years are definitely going to see a downturn in all our lives in some way or the other. And especially for people working for themselves who are self-employed, etc., it can be more traumatic. I'm sure even when it comes to dispute resolution, etc., the courts are going to see different ways of handling this. You're going to have different ways that you're going to charge your clients. It's going to, all of it is going to change. So it's the uncertainty of it that's going to bring in a lot of problem. But the second thing I think is that all of us are realizing that we need to possibly shift away from merely looking at our material possessions to really looking at life satisfaction, as the person mentioned about looking at happiness, better relationships with our families. So I think what we value in society is also in some ways undergoing a change, but whether it is for the better or not, we'll have to wait and watch. They say human memory is very frail, that 2 years down the line we'll forget all this and we'll go back to to our making money pursuits, to our to our looking for more materialistic possessions and so on. But I think certainly now is a good time to really balance out what is absolutely necessary for us. And of course, financial independence, financial security is going to be independent thing. And therefore, looking at alternate ways in which we can ensure how our incomes are stable, how we can look after things, but also looking for alternate ways of doing business. Because just as it's going to be a new normal, it's going to be a new normal, a new thing for the way we look at business as well. So I think it's going to be looking at a whole lot of these things to finally realize whatever is important for us is reasonably met. That's going to take a while, but I believe we're going to be traveling to that, towards that direction.
Thank you so much, Doctor. I think I completely agree with everything you said. And it's very important for us to stay optimistic during this period of uncertainty and be mindful of the C's that you mentioned, to be compassionate and also compromise, as well as effectively communicate and ensure that there is conflict resolution. And also identify signs of the worried as well as signs of depression, and try and ensure that people who have these symptoms ensure that they get and seek professional help, and also make sure that we have time for ourselves. Again, thank you very much for this session. I'd like to express my heartfelt gratitude to Dr. Murthy for her valuable time and insights. I'd also like to thank the attendees of this webinar for tuning in on this webinar through Zoom as well as on YouTube. Kindly stay safe and take care. Have a pleasant weekend, everybody. Thank you. Thank you, Dr. Murthy.
Thank you very much for having me, and good night.
Thank you.